A stroke is a brain attack. It happens when blood flow to part of the brain is cut off. Brain cells deprived of oxygen and nutrients begin to die within minutes. Hi everyone, welcome to my YouTube channel, My Health and Me by Fun. Please like, subscribe and share. Stroke is a medical emergency requiring immediate attention. Timely treatment is crucial for minimizing brain damage and improving chances of recovery. Strokes are a leading cause of death and long-term disability worldwide. There are two main types of stroke: ischemic and hemorrhagic. Ischemic stroke, the most common type, occurs when a blood clot blocks an artery supplying blood to the brain. These clots often form in areas where arteries have been narrowed by fatty deposits called plaque, a condition known as atherosclerosis. Hemorrhagic stroke, on the other hand, happens when a blood vessel in the brain ruptures. This bleeding within the brain compresses surrounding brain tissue, disrupting its function. Hemorrhagic strokes can be caused by uncontrolled high blood pressure, aneurysms, which is a weak spots in blood vessel walls, or arteriovenous malformations, which are abnormal tangles of blood vessels. The FAST acronym is an easy way to remember the most common symptoms. Face drooping. Does one side of the face droop or feel numb? Ask the person to smile and observe for asymmetry. Arm weakness. Is one arm weak or numb? Ask the person to raise both arms and note if one drifts downward. Speech difficulty. Is speech slurred or difficult to understand? Ask the person to repeat a simple sentence and listen for any abnormalities. If any of these signs are present, call emergency services immediately. Additional stroke symptoms include sudden confusion, trouble seeing, dizziness, loss of balance, and severe headache. Remember, every minute counts. Don't delay seeking medical attention if you suspect a stroke. Several factors can increase your risk of stroke. Some risk factors are non-modifiable, meaning you cannot change them. Risk increases with age. Men are slightly more likely to have a stroke, family history of stroke, and African Americans have a higher risk. Modifiable risk factors, however, can be controlled through lifestyle changes or medical treatment. High blood pressure is a major risk factor for stroke. Other modifiable risk factors include smoking, diabetes, high cholesterol, obesity, physical inactivity, and unhealthy diet. Managing these factors can significantly reduce your stroke risk. Diagnosing a stroke involves a physical exam, neurological assessment, and imaging tests such as CT scans or MRI to see what type of stroke is happening and the extent of brain damage. Blood tests to check for clotting issues or other risk factors. Neurological exams to assess brain function and the severity of the stroke. Treatment depends on the type of stroke and the severity of the damage. For ischemic strokes, clot-busting medications may be administered to dissolve the clot and restore blood flow. Other treatments include procedures like mechanical thrombectomy, where a device is used to physically remove the clot, or medications to prevent further clot formation. Hemorrhagic stroke treatment focuses on controlling bleeding, reducing pressure on the brain, and preventing complications. Surgery to stop the bleeding or relieve pressure in the brain. Medications to control blood pressure and prevent further bleeding. Prevention is key to avoiding stroke and its debilitating effects. Adopting a healthy lifestyle, managing existing medical conditions, and following your doctor's recommendations are crucial. Quitting smoking, limiting alcohol consumption, eating a balanced diet With plenty of fruits, vegetables, and whole grains, exercising regularly, maintaining a healthy weight, and controlling blood pressure, cholesterol, and diabetes can significantly reduce your risk. Be aware of the signs, manage your risk factors, and seek immediate medical attention if you suspect a stroke. If you found this video helpful, give it a thumbs up and don't forget to subscribe, like and share for more health tips.